We focus on ticks, and Lyme disease gets the lion's share of the attention because it is the number one vector-borne illness in the United States. The CDC estimates over 450,000 cases a year in the U.S. Lyme disease is carried by the blacklegged tick, the Ixodes tick. Things we're looking for early on in an illness is rash, fevers and chills, aches and pains in a majority of cases, but not all, causing that very recognizable bullseye rash. Luckily, it doesn't cause a high degree of mortality, so it doesn't outright kill, but the burden of morbidity, so the burden of and the chances of ongoing and chronic illness and pain and discomfort is pretty high. And especially we take that in the context of how difficult Lyme can be to detect. We have tests, but the way that your body's immune system reacts, it is not always easy to tell whether the symptoms that a person is feeling is really from a Lyme infection or some other cause. With Lyme disease, we want to catch in that initial phase because if we treat with antibiotics, we can cure patients and never, have further problems. If we don't catch it in that initial phase, goes on to the more dangerous secondary and tertiary phases, and at those points we're starting to introduce risks such as like meningitis, heart blocks and rhythm dysfunction of the cardiac system, arthritis developing in otherwise totally healthy 10-year-olds. The disease, in that secondary and tertiary phase, we can treat and kill the bacteria still at that point, but by then, a lot of times the damage to your immune system or those tissues is already done, and there's no great and easy way to undo that damage. Whereas in the primary phase of infection, we're talking, system tissue, and antibiotics are very effective.